about this event that is being live streamed. And now we'll move into the session proper. Today, we'll be focusing out of the 7 areas, focus areas, 2 focus areas: disease prevention and treatment and environmental preservation. And we will be hearing from experts from Korea and Japan. First of all, we will hear some Korean presentations in the field of disease prevention and treatment. And we will start with the presentation from John Linton, who is the director of the International Healthcare Center of Severance Hospital of Yonsei University. And he will be talking about differences in healthcare concepts between the East and West. And we have prepared the video, so let's watch it.
Linton. I work at Severance Hospital under the Yonsei University healthcare system in Seoul, Korea. Our center is the International Healthcare Center here in the hospital, and our hospital is a 2,500 bed, very large tertiary university care center. The title of my talk today is Differences in Healthcare Concepts Between the East and the West. I am very sorry to say that I'm going to switch into Korean because my understanding is the greater audience is listening in Korean. 다시 인사 올리겠습니다. 연세대학교 세브란스 병원의
Once again, I'd like to greet you again. My name is John Linton, and I'm the director of the International Healthcare Center of Severance Hospital of Yonsei University in Korea. Today, I will be talking about the differences in healthcare concepts between the East and West. I'll try to make my presentation brief but rich in content. First of all, regarding the Severance Hospital of Yonsei University, it was started by Dr. Allen, who brought in Western medicine or modern medicine from Korea into Korea for the first time. And Minister Min Young-ik was sustained severe sword wounds by Japanese assassins in 1885, and Dr. Allen successfully treated him with modern medicine, and that created the foothold for Western medicine to grow and advance here in Korea. In the West, scientific approach is everything in medicine. Who am I? What is the problem? And how am I going to solve this? So self-identification, and problem resolution are very important in the scientific approach for Western medicine. And one of the things I felt when working here in Korea is, well, 95%, even 97, 98% of patients are good patients. They don't create problems. But there are about less than 5% of the patients are difficult patients, and how you satisfy them is the crux of medicine. And we can't share religion, but we share an ideal philosophy. ASK, A for attitude, and S, skill. With skill, high skill, we have to win the confidence of people. We have to dress well and neatly, and knowledge is also important. K is for knowledge. Well, it's not the most important, but it is something that we basically have to have in order to be good doctors. I've been working here in Korea for 30 years, and one thing that I can really feel is the curse of being big. If you think big, sometimes you fall into the curse of losing the details. You don't treat the patients like patients. You treat patients like patients, not like family members, and you become indifferent. And the biggest problem is anybody and somebody and nobody. So you think that somebody will do it, but nobody does it in the end. So our goal is to make nobodies into somebodies who will take action. And continuing with the comparison, the concept of medication. In the West, medicine is a toxin. So it's a necessary evil, but it does harm to your body as well. But in the East, you have the concept of yin and yang, and you want to address the imbalance of yin and yang in your body. So in the East, the more the better when it comes to medicine. So people like medicine, like taking medicine in Japan, in Korea, in China. People seem to like taking medicine. But in the West, the emphasis is on the scientific approach. It has to be evidence-based medicine. Does this have effect? Well, 30% of patients think that even if you grind a table into powder and make medicine out of it, it will have an effect. That's the placebo effect. So in the West, it has to be a scientific approach to medicine, but in the East, science-based medicine is just one of the alternatives. If you have appendicitis, of course you have to go to a surgeon, but besides that, science-based approach is just one of the many alternatives. And another important difference between the East and West is about informed consent. So in New York, for example, if you have signed on your driver's license, if you are in an accident and you are pronounced brain dead, then two neurologists will just harvest all your organs for organ donation. But here in the East, although the attitudes are changing, your family members' consent is more important than your own consent. And telling patients of what they are suffering from, well, everything is told to the patient directly, although, of course, not everything all at once. But in the West, you tell the patient directly the morbidity rate, you have how many years to live, and so on. But in the East, you don't tell that to the patient directly. You explain things to the family members. And one of the biggest factors that caused misunderstandings when I started working here in Korea was, well, after coming back from studying to be a doctor and we're starting work here in Korea, I thought that American nurses were better than Korean nurses because they provided total care to all the patients. But if you look at the ICUs in Korea, the Korean nurses are as good as the American nurses. If the family members are out of the scenario and behind closed doors in ICUs, Korean nurses were just as good. And I make the recommendation that you should have a professional caregiver rather than depending on your family members when you're bedridden and you're unable to go to the restroom on your own. And another big difference is in payment systems. In the West, you pay after you receive the medical service, but in Korea, you have to pay beforehand, before you receive treatment and before you even meet the doctor. And I thought that this system would end up closing down the hospital. So I introduced something called the midway payment. You pay in the middle of receiving the medical treatment, midway in the process. And one thing that Korea seems to badly need is more reforms in the healthcare. I know that the IMF, when we came under IMF stewardship, it was very difficult times, but we need more reforms, especially in the healthcare industry, which seems to be very socialized here in Korea, if you want to put it in negative terms. And so we need to create the Hallyu or the Korean wave for the healthcare industry. And this kind of socialized system could be an obstacle. So in medicine, is medicine a basic right or can it be a privilege? At the UN, it says that healthcare is a basic universal human right. So personally, I think that the national universal healthcare insurance can be a safety net for everyone, and anyone can receive such basic healthcare, but private health insurance can be taken up by those who want more privileges. So if we want to attract more patients from abroad to come receive treatment in Korea, to develop the health industry and health tourism, then this could be a stumbling block. And so we have to start stressing quality over quantity for such people that we want to attract from overseas to come receive treatment. And another thing that we find lacking is the lack of national stars to attract international patients. And those who come from overseas to receive medical treatment, they want specialized services. Wealthy foreign patients want high-quality services. But in the socialized medical system here in Korea, there is a worry that I might receive lower quality services from the guy next door. But here I want to stress what you call the Robin Hood spirit. To get those who are well-to-do, those who can afford it, to pay as much as possible and then distribute that to the poor. Why don't Saudi kings come to Korea for treatment? We need more than just high quality treatment and universal treatment. So we need to benchmark successful countries who have raised and advanced their medical tourism system. So we need to think more than just philanthropic. We need to think of medicine as something more than a philanthropic endeavor. That would be a big mistake. It's an industry, and we need to we need to find ways to attract more wealthy patients, international patients. So there are many ideas that we are floating, such as attracting Korean Americans to come to take advantage of the more inexpensive medical services here in Korea. And so we can go together. And there are many ideas that we can offer, packages that we can offer, package services, one-stop services, and travel packages. And the future is bright, I think, because Korean doctors are very skilled, and we have top medical devices and equipment. So I think we have the foundation to advance the medical tourism and medical industry here in Korea. Thank you very much for listening. Yes, thank you.
이야기를 해주신 인요한 한국
Thank you, Dr. John Linton, for that very interesting presentation.
그래서 코로나19의 건강 영향 및
Next, Professor Jae-wook Choi of Korea University's College of Medicine will deliver his presentation entitled The Health Impact of COVID-19 and Global Solidarity. Good morning. My name is Professor Choi of Korea University. It's a pleasure to be able to address you today. The topic of my presentation is the health impact of COVID-19 and a threat to global solidarity. Before I begin my presentation, let me start off by saying that at the present time, it is too early to evaluate one way or the other the impact on health that COVID-19 has had. There's not yet enough scientific evidence to evaluate the impact of COVID-19. What are the implications of COVID-19, and what are the roles to be played by international organizations such as Rotary International? That's what I would like us to think about today. As of the 15th of this month, globally, over 500 million cases have been reported. The number of deaths is 4.6 million. The Americas, North, South, and Central Americas had the highest number of deaths reported, as well as the rest of the world being hit hard by COVID-19. As for excess mortality, which is deaths from other illnesses, that has increased. There are many reasons for this because doctors were focused on COVID-19 for one reason or another. excess mortality grew, and issues such as suicides increased globally, which is a great problem. Excess mortality is reported to be more than 3 million, and the number of unreported cases is said to be very high. Not only is the health impact of COVID-19 tremendous,
으로 인한 건강
because the medical system is too focused on tackling COVID-19, there are areas that are being overlooked. If you look at the figures regarding excess mortality, the US, Russia, and other areas where there are high numbers of population show high rates, as well as Peru, Mexico, and Bulgaria, and other developing economies who have vulnerable medical systems are showing spikes in excess mortality. The UN and WHO had announced that by 2030, certain Sustainable Development Goals, or SDGs, would be achieved. These are important goals the world has been working together to resolve. But both the UN and WHO have expressed pessimism on whether SDGs can be achieved by 2030. The progress toward these goals is lackluster. That can be seen in many areas, such as children's health, women and girls' health. The situation is worse than before COVID-19 began. And because the focus is on COVID-19, other infectious diseases such as malaria, tuberculosis, and HIV are spiking once again. So this is a manifold problem. So access to COVID-19 tools, in other words, a program to support developing economies to improve access to COVID-19 tools, has increased. This can be divided into 3 pillars or areas: diagnostics, therapeutics, and the healthcare system to oversee all this. Through building these pillars, we want to support developing economies. It's not undertaken by the WHO alone. Many international NGOs such as Gavi, the World Bank, UNITAD or UNITAID have risen to the challenge. So this is an example of the global solidarity and effort. However, the situation is not easy. It's far from easy. The vaccine inequality is an important issue, as you are aware. 500 million doses of vaccines have become available worldwide as of date, but the beneficiaries are mostly in the rich economies, such as the US and Europe. Most of the doses administered are in leading economies, whereas the least developed economies and the developing economies are not seeing the number of doses administered increase. WHO has established the COVAX program to provide vaccines to developing economies, but it will be in 2022, in other words, next year, when vaccines become universally available in developing economies and mid to low income countries. Till then, COVID-19 will continue to wreak havoc, which means that with the high number of cases, naturally the number of variants will increase. And if you have more variants, then this threatens the leading economies where most of the population have already completed their vaccination. So this goes to show that having just the rich economies and their citizens vaccinated is not enough to solve the problem. We need vaccination universally, globally, in order for us to truly start living with COVID-19 globally. This is why global vaccine supply is important. Let me talk to you about the Korean situation. Korea is known for K-quarantine, which is characterized by the 3T strategy: test, trace, and treat. Based on our experience of MERS back in 2015, Through public-private partnership, we have worked with developers to release almost the world's first PCR kit that offers easy diagnosis of COVID-19. So this is how during February, March, and April last year, we were able to effectively manage and keep down the number of newly confirmed cases. As you saw in the chart, during the same period, the number of cases and deaths skyrocketed in countries such as the UK, but in Korea, the figures were not so high. One of the benefits of Korea is universal health coverage. We have a strong social security system, which is not to be found in many places around the world. All Koreans receive the same health benefits regardless of income, and there is zero out-of-pocket payment. In other words, the public medical insurance guarantees that the state covers the entirety of your treatment expenses. Now let me wrap up my presentation. COVID-19 has caused trouble globally, and this could be an opportunity for global solidarity. It could be a threat to dismantle global solidarity that we have built up until now. As for how to plan the post-COVID-19 recovery, or how to plan the post-COVID-19 resilience programs, this has been discussed by OECD members, among others, and a key point was proposed by the relevant OECD committee. The rich economies can undertake their own resilience programs, but the low to mid-income countries, as well as the least developed economies, require a different approach. Back in May and June this year, the WHO General Assembly was held to discuss these matters, and various efforts of global solidarity and the future direction of WHO were discussed. Many experts say that the international community shall fight against COVID-19 through solidarity and cooperation. We don't know yet who the final winner of the COVID-19 pandemic will be because it's still ongoing, but the evaluation criteria will be as follows. Until now, the whole focus was on the number of confirmed cases, but going forward, it will be the number of deaths per population rather than the number of confirmed cases. And as I mentioned earlier, excess mortality, in other words, deaths from causes other than COVID-19, as well as health damage, will be important indicators. And we also need to think about the magnitude of economic and social impact caused by COVID-19 and the social assets of humanity, which is democracy, freedom and liberty, and solidarity. These have all been undermined. The historic assets built up by civil society have been damaged by COVID-19, and this should also be measured and taken into consideration. Last but not least, this is a photo that shows where the UN Security Council is currently. The hegemonic struggle between Russia, US, and other superpowers threaten to undermine the governance of international organizations such as the WHO. This goes to show the difficulty that we must tackle. International NGOs such as Rotary International have a long-standing history of undertaking important programs, charity, among others, and this is where your effort is needed. Let us think about what we can do together. Thank you.
네, COVID-19 팬데믹
Thank you. That was an important presentation with implications for all of us. Dr. Choi emphasized the importance of international solidarity and cooperation.
순서가
So what do we have in line next? Next, we will have a presentation entitled Disease Treatment and Rotary by President Nam Song-hee of the Daegu Health College. She was the 2005 to 2006 District 3700 governor in Daegu, and she is also currently heads the Korean Council for University Education. Let's meet her online.
Hello, I am RI District 3700 PDG Sung Hee-nam. It is my great honor and pleasure to be a guest speaker for this special event. Today, I'll be talking about the role of Rotary International in fighting various diseases around the world. In this long-lasting pandemic, I am, with a heavy heart, bringing this issue, but I think it is crucial that we as Rotarians to ruminate our roles and duties to help in fighting disease and saving lives. From now on, I will switch to Korean. 여러분 안녕하십니까? 국제 로터리 3700 지구 전 총재 남성입니다.
Hello, my name is Nam Song-hee, PDG of RI District 3700. Today, at the RI President Conference of Sheka Meta, I'd like to talk about the relationship between Rotary and fighting disease. As you know, infectious diseases sometimes become so severe that it threatens lives. And these diseases could be endemic, depending on the climate and environment of the country affected, or it could be so infectious that it stops human activities. All human activities come to a virtual standstill. That is what is happening right now with COVID-19. This picture shows how COVID-19, the coronavirus, is spreading throughout the world. This coronavirus is shutting down national borders. So much so that if you look at the number of flights that were happening before COVID-19, you can see that the lights have virtually disappeared after COVID-19. Every time we open our eyes in the morning, we ask ourselves, so how many have been confirmed cases today? How many cumulative confirmed cases? How many deaths? And how do the variants emerge? As you can see, we are experiencing the fourth wave of this pandemic with a huge spike in confirmed cases. But despite all these obstacles and difficulties, our activities have not come to a standstill. We're not stopping our actions. In December of 2020, the board of directors of RI have come together with the foundation, to form a joint task force team. And we are distributing vaccines when vaccines were still very new. And we have launched communications campaigns to encourage people to become vaccinated. And we are also spreading good habits such as frequent hand washing, social distancing, mask wearing, and so on. And under the leadership of President Holger Nack who said that Rotarians have a successful history of stepping forward to take action when the world needs our help, we have always taken action. And we have a successful history in that we have almost eradicated polio. And that is a global initiative that we have formed to build an infrastructure with our partners. And we are garnering it and harnessing it to fight COVID-19. In 1905, going back to the story of ending polio, Dr. Ivar Wigman discovered that polio was an infectious disease that you can contract without showing any special symptoms. And because of polio, so many children had to use crutches, and we had to cut down so many trees in order to make these crutches. And then in 1955, vaccines were invented, and this is the result. Since Rotary launched its End Polio project in 1985, this is the result. As of last year, we have only one case each in Afghanistan and Pakistan down from two-digit figures of polio cases. But even this one case of polio in a country means that we have to continue to supply vaccines. So we have continued our actions. As of January 2020, we have renewed our partnership with the Bill and Melinda Gates Foundation. How? We have pledged to raise an additional $450 million in funds to end polio in 3 years. And the Bill and Melinda Gates Foundation promised a matching fund for every $2. For every dollar we raise, they will match it with $2. So with that, we will be able to raise $150 million a year. That means in 3 years, we will be raising an additional $550 million. And with this, we have reached 99% of our goal, and we will have the final push to 100% completely eradicate polio. And so currently we are providing programs such as mobile phone text messages to find out where children need vaccines and how to get vaccines to them. It is very saddening that the Taliban have taken over Afghanistan, and this has made it very difficult to continue our project in Afghanistan. But we need to formulate strategies to get vaccines to children there. Another very important project that we are involved in is in the focus area of saving mothers and children. Rotary makes high-quality healthcare available to vulnerable mothers and children so that they can live longer and grow stronger. The mortality rate of children under 5 is currently 6.3 million a year, and the main cause of infant death and children's death is malnutrition and diseases that you contract from unsanitary environments, like a sore on your lip that spreads and eats up your entire face. And all these diseases result from no clean water and no clean healthcare facilities. So Rotarians are trying to address this problem through immunization. In Korea and in developed countries, you have a schedule for immunization to immunize your baby against all kinds of diseases like measles, malaria, pneumonia. And we are doing that in other countries as well. Health education for mothers to teach them how to breastfeed, to prevent infant mother-to-infant HIV transmission, and providing clean drinking water and sanitation facilities. The next focus area would be health of women, including pregnant women. And in sub-Saharan Africa, 1 out of 39 women die from complications during pregnancy and childbirth. That means 1 woman out of 39 who die from a disease or complications that could have been prevented if she had received adequate medical examination and treatment. So Rotary provides medical staff with medical equipment for deliveries and also mobile clinics. And we're distributing contraceptives and also information on how to use them. So in that way, we're sponsoring certified programs to fight ignorance. And President Sheikh Mehta has added environment as a new presidential theme, and we are also working very hard in that area. For example, to address the problem of 2.5 billion people who live without sanitation, like flushing toilets or clean public bathrooms. So we are trying to address poor sanitation and the lack of drinking water, clean drinking water. And so, as you know, about 1,400 children die every single day from guinea worm disease or diarrhea because of lack of safe drinking water. So we Rotarians are playing the role of building restrooms equipped with septic tanks and building facilities to store rainwater, and we use sand and coal to make simple water filters to provide clean drinking water and to prevent waterborne diseases. And we also try to spread sanitary habits like washing your hands frequently. The first ever Rotary community service that is related to sanitation was started by our great founder, Paul Harris, in 1907, building public restrooms in Chicago. Chicago did not seem not to have such public restrooms back then. And we are also fighting many other diseases. We are providing grants to support projects to fight diseases around the world. And the grant that is injected into fighting diseases is 76 billion Korean won. And you add to that grants from Rotary clubs, and that would be a very big fund. And with that fund, we are fighting malaria, HIV/AIDS, Alzheimer's, multiple sclerosis, and these days also substance abuse and misuse. And we are helping to build infrastructure for cooperation among doctors, patients, and governments. So there are hundreds of healthcare projects that are being led around the world by Rotary. And I would like to pay respect to you for your service to change lives. And may you continue to serve to change lives in the future. Thank you very much.